This week is National Nurses Week, a time when our country takes time to recognize the vital role that nurses play. Here too in Johnson County, nurses are essential to the work of many county services. Whether it's in mental health, one of the county's health clinics, or in the county's support for people with intellectual and developmental disabilities, you'll often find nurses on the front lines of these efforts. On this episode, we'll welcome some nurses who will tell us about their important work, and we will discuss how critical nurses are in helping the county provide key services to its constituents.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Andy Highland. I am a Johnson County resident and I work in communications at Johnson County government. And we're here to celebrate National Nurses Week, and we're being joined by a variety of guests, including two nurses who work in our Department of Health and Environment, Barb Thompson and Dawn Mangan. Welcome to both of you.
Thank you. Thank you.
We're here to talk a little bit about your work and why it's so important. And so why don't we start? Why don't the two of you just introduce yourselves and what you do for the county?
Okay. My name is Dawn Mangan, and I am the Outreach Program Manager in the Community Health Division of Johnson County Department of Health and Environment.
And I'm Barb Thompson, registered nurse, and I work in community health as well at the Department of Health and Environment, and I'm an outreach nurse, which means I go out in the community and make visits to senior adults in the community.
Wonderful. And so, Barb, why don't you start and talk about why did you get into this field? What was it that attracted you to the work?
Well, and Dawn knows this because she's the one that called me and said, there's a job opening. We worked together years ago as nurses in an office, and I've always had a passion for senior adults. I love listening to their stories. I love that they were raised in the community and have all these stories like from World War I, World War II, things like that. But yeah, so there was an opening for a senior adult nurse, and Dawn called and said, hey, there's an opening here. And I was working at a cardiology office, and I came right over, got the job, and I've been here 17 years, and it's the best job ever.
Wonderful. And what about you, Dawn?
Well, I started out actually in social work, and then had always been interested in the medical field and started working in a clinic because that actually paid more than the social work position. Mm-hmm. And I was, a young mom, and I decided that I still had an interest in the medical field. So I went back to school into nursing, and this is really going to date me, but believe it or not, when I graduated, they weren't hiring new grads in the hospital unless you had at least a year of experience. That's no longer the case. So I kind of went a different direction and started getting more into the health education piece of it and became really interested in women's health. So I started off with Department of Health and Environment as an immunization nurse and did that for about 6 months, and then became a mother-baby outreach nurse, and now I'm the program manager for outreach.
Wonderful. And I think, one of the things I can just tell from our conversation already, the wide variety of things that nurses do.
Exactly.
And there's just a whole bunch of different stuff. Why don't you tell me what is rewarding about your particular area, and what do you find most rewarding about your work? Whichever one of you would like to start.
Well, I've been with the county as an outreach nurse for 20 years. And something that I really have recognized is the importance of getting into people's homes and recognizing that that is a huge part of their health in general, is assessing their environment. And we, a lot of times, will work with low-income families. And so just, getting into the home, making assessments, and maybe connecting them with other resources that we've identified that there is a need for is just has been very rewarding. And when I first started in nursing school, you kind of just have that frame of mind that it's hospital and clinical nursing, and it's actually so much more.
So, Barb, why don't you tell me about your favorite part of the job?
I was a medical assistant for 17 years, working for various doctors around the Kansas City metro area. And then I became a nurse later in life. And I'm so glad I did it. I have to tell you, I've always wanted to be in the medical field. When I was growing up, every Halloween I would dress up like Florence Nightingale, and my mother would say, "Do you want to be like a astronaut or something?" I don't know. Anyway, no, I want to be Florence Nightingale. So anyway, I always had this idea of helping people out, making a difference. I know that sounds like everyone says that, but that's really true. And Dawn will say the same thing, I think. So the most important part of my job as a nurse, public health nurse, is we do various things. Like we were doing COVID vaccines, testing, COVID hotline, just in it. Actually, it was very stressful, but it was so rewarding. Giving those shots in those arms was amazing. And then fast forward, when we stopped doing that, we got to go back to our other jobs where I make home visits to senior adults and just going into people's homes and seeing their environment, like Dawn said, and to see if there's any fall risk, or just connecting those clients with physicians or any resources, either be a Johnson County agency or private practice or private agency, just to make their life better. Sometimes when I go into people's homes, I have an agenda in my mind, but when I go there, I have to kind of meet them where they're at. If they're having back pain that they didn't have before, I have to figure out, all right, let's figure out how to help them out. What kind of resources can I use? But so there's actually two things that are my favorite part of the job, is being one-on-one with these elder adults with their stories, and just beautiful stories I get to hear. It's amazing. And then the other is connecting with all the resources, like area agency on aging, mental health, just private agency as well, to connect these clients, and just appreciation. People are so appreciative just for a nurse to come to the home to talk to them. And then there's no hurry for me. I don't have to rush through an appointment, because sometimes the nurses, the NFP nurses, which is the Nurse Family Partnership, that they see mother baby clients, they take their time as well. And it's really important, I think, don't you think, Dawn, that they don't rush through their appointment, that
I think with these home visits too, it's more of a therapeutic relationship, and not, it's not an acute situation. It's an ongoing relationship, because we do tend to see them for, a lot of clients on an ongoing basis. So as an outreach nurse, I've also worked in the clinic. And so people coming into the clinic may not disclose a lot of information that you can assess when you go into the home. I've been into homes where you walk in and there's no furniture and very little food. And so getting people connected with resources that can help is extremely rewarding. And then when you go back and look at their chart, you don't see any information that's been disclosed in the clinic about some of the needs that they may have. And then also just, I was a mother baby nurse, seeing these women in, the first week or two after they deliver, because oftentimes, they'll deliver their baby and they've been seen weekly up until that point. And then they're given a postpartum exam appointment, and there's that whole gap of 6 weeks where they may have an issue, they may have a problem. They're not, they're not going into the clinic for an appointment. And so the nurse will come to their home and weigh their baby, do a brief exam, do a postpartum exam. And that was really rewarding for me as an outreach nurse, especially if you identify a problem or an issue that may not have been caught.
Wonderful. Well, I think one of the things that Nurses Week is all about is saying thanks, and thanks to you both for all the work that you do. And it really makes me think, what is the best way for people to say thank you to you if you're out doing your work? What's the best way for people to express appreciation?
For me, just when people say thank you, I mean, I'm thinking about going through COVID, and in the beginning, when we just didn't really know a lot, and people were so angry, um, that was difficult. But then the people that were thankful for whatever information we could provide, and then when we started vaccinating people, um, just the thanks that we got just made you feel so good. So I think it's just the verbal thank you is rewarding for us.
I have to agree with Dawn. Just the COVID, we had notes that were sent to us, and just the gratitude, and there's always going to be naysayers, but the gratitude way outweighed the naysayers, and that was appreciative. And in my regular day-to-day job, if I see a client and I talk to them about a resource, or I educate them about their blood pressure, and they actually do what I tell them, that's like, and I know all nurses feel the same way. Like, if you give advice to a client and they follow through, that is wonderful in itself.
Exactly. And identifying a problem when you go in, and realizing that it was a true problem that if you wouldn't have been there, might not have been discovered, and then they get treated, and the outcome is positive. That's just very rewarding that you made a difference.
Yes.
Fantastic. Well, that's great. And we like I say, thanks again for all you do and for the county and for taking some time to talk with us here on National Nurses Week, which, as I understand, is correlated with Florence Nightingale's birthday. So, I think that's the Friday of this week, which I think is, so I think that's a nice little tie-in to all of this. So,
well, I won't wear my costume on Friday. My Florence
costume. Okay, very good.
I outgrew it.
Very good. Well, thanks again to you, Barb and Dawn, for taking the time and for visiting with us today.
Absolutely.
Thank you so much, Andy.
Thank you.
So we are joined now by Shelley May, the Deputy Director of Johnson County Developmental Supports, to talk a little bit about the important role that nurses play in your organization. So welcome, Shelley. And
thank you.
Maybe we can start by you tell us a little bit about you and your role and what Johnson County Developmental Supports does.
Great. All right. Thank you, Andy. So pleasure to be here with you today. Johnson County Developmental Supports provides services to residents of Johnson County who experience intellectual and developmental disabilities. We serve almost 600 people with case management, day services, residential services, behavioral health, and clinical services like our nursing department.
So maybe you could talk a little bit about what nurses do for Johnson County Developmental Supports. Where in all your services do nurses engage?
All right, I would love to. So we could not do the work that we do without the support of our nursing department. As I said, we support individuals who experience intellectual and developmental disabilities, and those services that we provide are provided by unlicensed staff, direct support professionals. So people who are in these roles are helping with daily living skills, recreation, employment, residential skills, learning to live independently, work independently, and play independently. So our nurses provide extensive training to our staff in regards to supporting people with their medications. So all of our staff do have go through medication administration training. They also go through a nursing delegated task training just to help with other kind of routine things that you or I would take care of if we, experience a disability, but the people that we support do need assistance with that. So our nurses provide that training to staff to ensure that people are living their healthiest lives possible. So a lot of focus on preventative health and wellness, and like I said, training. In addition to that, the nursing team really helps us with our policies and the way that we're structured, again, to ensure that people receive the highest quality of service and again, the best health possible.
Great. And maybe you can tell me just how many nurses do you have, just about an estimate maybe of how many folks you have working for you?
Very easy to do. We have 4 nurses that provide all of that support to our staff. So the team is led by a registered nurse, and then we have 3 LPNs that work under her. Kind of the unique situation for developmental disability services is that they are our only licensed staff that work for us, is our nursing staff. And the support that they provide actually falls under their license. So again, unique in that professionally, they have a lot of responsibility because the services that we provide tie back to their license, because they're ensuring that the direct care staff that we have are following all the procedures correctly, that they understand what they're doing, and again, just that people's health is being protected.
And I think, so obviously this is National Nurses Week. That's why we're here. So I think part of that is just appreciating all the work that they do. So maybe you could tell me, we've touched on a few of them here, but why are these nurses just so important to what you do?
Well, I think what draws the nurses to working with JCDS and with this population is that, kind of opposed to other clinical settings, you really develop a relationship with the people that you're supporting. And so, in other kind of places you kind of treat, it's kind of like you get to know somebody, you treat them, and then they're released and you might not ever see them again. Whereas here, you really get to follow that person like throughout the lifespan. And so their support and knowledge is just so important to ensuring that kind of sometimes the complex medical support needs that people have, that those nurses are engaged. Everybody in our agency, we have 311 staff within JCDS. Everybody knows our nurses. Everybody is engaged with them. They're engaged with all of our staff. And of course, all the people that we support, they really look to the nurses as, kind of their first line, even sometimes more trusted than their doctors and other medical professionals, because they have such a deep relationship with the nurses that work here.
Well, thank you, Shelley. I think it's a great example of the critical work that nurses do, not just in Johnson County Developmental Supports, but across the whole organization. And I appreciate you taking some time to share with us what they do for you all and for our whole group. So thanks for taking the time.
I did want to just brag on our nurses for a minute, especially our lead nurse, Erica Burrows. Not only is she an expert in being a registered nurse and in the healthcare field, she also has an additional level of certification through the Developmental Disabilities Nurse Association. So she also has extensive knowledge and training specific to supporting people who have developmental disabilities. And it's something that we support all of our nursing staff to get. So we have really just a well-trained, knowledgeable team here at JCDS. And we truly appreciate what they do, not only for our organization, the families we support, but most importantly, for the people who receive our services.
That's great. And so thank you again so much for taking the time to talk through some of it with us. We certainly do appreciate them, and we appreciate you. So thank you very much.
Thank you, Andy.
Thanks to all of our guests for sharing such good information today. Just to summarize a few items we covered and where to learn more. Our nurses perform a myriad of services. We heard from some who do outreach services for new moms and senior adults, but they also provide services for mental health and our work supporting people with intellectual and developmental disabilities. To learn more about Johnson County's Outreach Nurse Home Visiting Program for older adults, visit the Department of Health and Environment's website. Thank you.
You just heard JoCo on the Go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCo.gov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.